Hi, this is Dr. Yoon Hang Kim. Today I'm going to talk about something uncomfortable, so I may pause, it may take longer time. The In medicine, both functional medicine, integrative medicine, and conventional medicine, there's something in common. I'm seeing more and more that people are using protocols and they're taking a cookbook approach to healing. And what I'm seeing is that, like today or this week, I've seen two people who went to functional medicine practitioners who did the protocol, but they didn't know what to do with the results, and their symptoms are not better. One of them said it's worse, and they didn't know what to do. And I think this is not that different than what I'm seeing in conventional medicine. And I think part of the problem is that um, the functional medicine is practice of medicine. That means that the better your medicine is, the better your functional medicine can be. It's the basics. You can't escape that. So, so people who don't have medical background, I would say that chiropractors lack medical background in the conventional sense. Nurse practitioners and PA lack the intense residency and medical school experience, as a lot of them are now online trained for 2 years, and their clinical experience compared to physician who have spent full time being trained for 4 years plus in residency, it's like you're having almost two jobs or sometimes more. So that intense exposure to medicine can't but give you a deeper level of medical training, whether you want it or not. I'm not saying that's right. I'm not saying that's humane to doctors. All I'm saying is that if you practice functional medicine, you have to know medicine, and then you have to know functional medicine. It is called a medicine for a reason. So I'm not of opinion that you have to be an MDDO to practice functional medicine. I think that's a legal matter. What matters is that what kind of training do they have in medicine? What kind of training do they have in functional medicine? So in my case, when I wanted to go into this field, I was given advice that I should do more than regular physicians. Regular physicians go to medical school and then they go to residency and they're done. So in my case, I went through medical school and I did 2 years of research in during medical school, and then I did two residencies, and then I did two fellowships. And I'm not saying this is necessary to become a functional medicine physician or a great functional medicine physician, but what I can say is that that's, I think, the basic. After that, I did integrative medicine, I did Chinese medicine, and then I went into functional medicine. And I feel like everything that I did just is enough for me to tackle um, complex problems. So imagine if you don't have that kind of background. And sometimes my research experience in biochemistry and pharmacology comes in really handy for understanding biochemical pathways as well as pharmaceuticals and supplements. And because the functional medicine is so popular, you're gonna be able to find a provider relatively easily. But as they said, buyer beware. If you have run of the mill problems, I think it's quite appropriate those people can help you. If you have more than one problem or very complex issue, then it's possible that they cannot help you. And if that happens, you have to understand that you have to begin all over again. And if you don't like that, I would say choose well and consider, if you don't have anyone near you, consider going to places like Cleveland Clinic, functional medicine clinic. It's going to be several months wait. It'll be very expensive, but I think they will do at least a basic job, and hopefully. And if they don't, contact me, let me know, and I'll stop promoting their services. This is Dr. Yoon Hang Kim. I'm an integrative and functional medicine physician, and my expertise include LDN therapy, which is another video all of its own. So thank you. I appreciate you. Bye bye.